Hi, everybody, and thanks so much for joining us today. My name is Greg Olson. I'm the director of the New York State Office for Aging. I'm very pleased to have with me Kayla Snyder from Hunger Solutions, and I will introduce her more formally in a second. We're going to talk a little bit today about how to increase access to food. There's nothing worse than being food insecure or hunger, regardless of how old you are. We know that food is medicine. It's critically important, as studies have continued to show for decades, for young kids who are growing, and specifically for older adults, which is what we do, to help manage a chronic condition, help recover from an illness or injury, and just how important it is to our overall health and well-being. New York State has always been a leader in addressing hunger and food insecurity. There's a lot of state agencies, local agencies, not-for-profits like Hunger Solutions that really work together to try to address hunger across the age spectrum. It's been particularly important, obviously, during the pandemic, where economic insecurity, loss of jobs, and stay-at-home notices made it very difficult for people to access the food they need every day. Next month in March, which is really only a couple of weeks away, it's going to be the 50th anniversary of the National Nutrition Program for the Elderly, which really established in New York State our home delivered meal and congregate program that we administer in partnership with 59 county offices for the aging and hundreds of additional contractors. I raise that because we're looking at this issue holistically, but we have the largest nutrition program in the country. We have exceeded 1 billion meals served over that 50-year period to over 10 million people. So that's something we'll be talking about next month. There are a lot of tools in the toolbox to help address hunger and food insecurity. Our program is one of them. But why I wanted to have Kayla on here is to really talk about the Supplemental Nutrition Assistance Program. It's called SNAP. We're going to talk about what it is, how to qualify, what the benefits are, and some of the most important things are the resources to help you get connected and to dispel the long-standing myths that have been associated with the SNAP program. So I'm going to introduce Kayla Snyder from Hunger Solutions. Kayla is an experienced human services professional with over a decade of service advocating for underserved groups in New York State. She joined Hunger Solutions in 2021, had wound up doing an internship there in 2016. She currently leads the SNAP and Senior Professional Network, a new initiative at Hunger Solutions. The network is a one-stop shop for SNAP policy, best practices, outreach materials, and resources to increase provider knowledge about SNAP benefits. And we're going to provide some resources for that. We not only like to bring good topics here, one of the most important things we need to do is connect people to the resources that are going to get them the help. And that's always the primary part of this. So Kayla, thanks so much for joining us today. I'm looking forward to this conversation.
Thanks so much for having me. I'm excited to be here.
My pleasure. So first, let's talk about Hunger Solutions. What is it? What do you guys do?
So we are a statewide organization. We advocate for the maximization of the federal nutrition programs here in the United States. Aside from SNAP, we also focus on WIC, school meals, community eligibility provisions, and many more. We also manage the Nutrition Outreach and Education Program, which can help connect folks to SNAP in their communities. We'll talk a little bit more about that later too.
Right, so your goal, and I know this, I'll give this a little precursor. 20 years ago, I worked for your organization. It wasn't called Hunger Solutions at the time. So we're going to talk about NOAPs because, again, connecting with community resources is really important. But the goal of Hunger Solutions is to maximize federal feeding programs, and there's a whole bunch of them, SNAP being the largest, the Children's School Nutrition Program as well. So again, people might remember SNAP as food stamps. It's the Supplemental Nutrition Assistance Program. So tell us what that is.
Yeah, so it is our nation's largest federal nutrition assistance program. It was renamed SNAP in the 2008 Farm Bill. Some folks still call it food stamps. In New York State, it is administered by the Office of Temporary and Disability Assistance. So they are responsible for administering SNAP as well as overseeing local DSS offices to ensure they have up-to-date policy information, directives, and other regulations.
Okay, and so for an older individual, how would they qualify for SNAP? What are the income guidelines, any other guidelines? Because there is an eligibility criteria.
Correct. So eligibility rules vary depending on age and household status. For older adults, they are considered seniors for SNAP purposes at age 60. They qualify for SNAP at 200% of the federal poverty line, which is a little bit higher than some standard household rules. So for example, a senior who lives alone can have as much as $2,147 of monthly gross income and still qualify for SNAP.
Right, so an annual income of around 24,000 is the 200% of poverty. Any asset tests or any other types of things that would make somebody ineligible, or is it just income based?
So it is income based, but if you don't meet those income guidelines and you also pass a net income test, you might be able to pass the resource test. And for seniors, there is a higher resource limit for them as well.
Yeah, and a couple things, sometimes the eligibility for programs gets very complicated. So I'm listening to you. You do this for a living every day. For those of you who are watching or will watch in the future, knowing the details of all this is not important. What's important is to know where to go to see if you might be eligible. And we're going to talk about the nutrition outreach and education programs around the state that Hunger Solution oversees on behalf of the state and federal government, but also the local offices for the aging. The takeaway is never to have to remember all the details. That's why we have partnerships and experts like yourself. What are the kinds of foods that SNAP can purchase, and what are the types of foods that SNAP is not allowed to purchase?
So you can buy a lot of things with your SNAP benefits, meats and fish, produce and dry goods, plants and seeds that grow food, honey, herbs, juice, coffee, other beverages. What you can't buy with SNAP includes alcoholic beverages or hot prepared foods.
Right. So if you went into a supermarket, and this bothered me, we tried to get this changed during the pandemic. You can buy a raw chicken, right, with SNAP, but you can't buy a cooked chicken, which would have made it pretty easy for people to still meet their nutritional needs, but that is still not allowable. Is that correct?
Correct. A hot cooked chicken you cannot buy. I believe if it's cold, you can purchase it.
Right. So all of those supermarkets now that have, all of these sections of food, if it's hot, is that the standard? If it's hot, it can't be purchased.
Correct.
But spaghetti with meatballs, that's in the refrigerated section, that can be.
Correct.
I'm not sure what sense that makes, but we'll keep working on that. Now, back in the day, people would actually get paper coupons. What if somebody's eligible now and is deemed to be able to receive the benefit? Are they going to get those coupons anymore?
You don't get coupons anymore. Now you get what is called an EBT card. It stands for electronic benefit transfer. It works similar to a debit card. When you go to the supermarket, you can use it to check out. You enter your PIN and it will deduct your benefits. And when you get your receipt, it should tell you how many benefits you have left on it as well.
And do the benefits roll over month to month? So if I'm getting $200 a month, but I only used $50 this month, what happens?
They absolutely roll over. Your SNAP benefits will roll over month to month. They do expire 274 days from the date that they were issued. So everyone is receiving an emergency allotment of SNAP right now. And a lot of folks are afraid to spend those benefits. They will stay on your EBT card again for 274 days from the date that they were awarded, but definitely use those benefits if you need them.
Yeah, and I really like the switch to the EBT card to really address stigma. And that's what I want to talk to you about, because when I had started in this work specifically on older adult nutrition with SNAP, there were three primary things that I would hear from older adults on why they don't participate. And I want to know if those things are still relevant and if there's any new ones. But let's talk about the first one. That was a big one, which is why I like to switch from the paper copies, because anybody in line behind you can see what you have versus an EBT card, which could be a bank card, a credit card, or something that makes it a little bit more comfortable for somebody to, unfortunately, buy food because of the stigma. Is people think that this is welfare. Is this welfare?
So SNAP is an entitlement program. Anyone who qualifies under program rules can receive benefits. If you need assistance buying food, SNAP is there for you to help you put food on your table, to make sure that you have food every day.
What I find fascinating about things like SNAP is how some entitlements and benefits people receive and don't think twice about. Tuition assistance, star property tax, companies that utilize the tax code to get benefits. Those are all seen as fine, but for some reason we vilified things like this. And I think, to Kayla's point, folks that may be eligible and in need of assistance to eat every day and to help you stay healthy, your tax dollars have paid into this your entire lives, for the event that if you're on a fixed income or something happens where food insecurity really becomes a problem for you, that's what it's there for. And your dollars are helping to pay to support yourself if you need it, or somebody else. Another myth, and I want you to address this, is, Kayla, if you apply or if I apply and I receive benefits, then I'm going to be taking food out of somebody else's mouth that might need it more than me.
That's not true at all. So as we said earlier, it's an entitlement program. If you qualify under program rules, you will be able to utilize and receive SNAP benefits. We've seen a significant increase in food insecurity since COVID-19 began, and SNAP has responded to that increase. We've seen, emergency allotments, pandemic EBT. So SNAP is there. It's there to help you. If you need it, you can absolutely apply and utilize it if you qualify.
Okay, and the third one, and before I ask you if there's any additional ones that have cropped up in my 20-year absence, is how low the benefit is. And it's just not worth it to apply. Now, again, when I was working where you were, the myth was the average benefit was about $20. I know that not to be true. So can you address that as well?
Yeah, so with emergency allotments, the benefit is a little bit higher right now, but currently $20 is the minimum benefit for seniors. It might not be a lot, but there are certainly things that seniors can do to maximize that benefit. Right now, $290 is the average benefit for households with seniors and children and no other adult members. $158 is the average benefit amount for seniors that live alone. And $166 is the average SNAP benefit amount for households with seniors. Once pandemic EAs end, with the increase of the Thrifty Food Plan, we expect the projected average monthly benefit for all SNAP users to be $169. Right. So you might receive the minimum, you might receive more. We'll talk a little bit later about some things you can do to maximize your SNAP benefit amount.
Right, but I think the point that you're making is that's a myth. If the average benefit is around $160, that means there's going to be those above and below. That's almost $2,000 of food support a year. I mean, think about that for a second. If you're having trouble, paying your rent, or deciding to buy groceries or other types of household items that you need, and you can receive almost $2,000 in nutrition support every year, why wouldn't you be doing that? So we want to make sure that we're addressing these myths. So New York did something a little bit different, and we're going to highlight you in a second because you helped us with this. What is a simplified application, and what does it do?
Sure. So beginning in December 2021, OTDA unveiled the Elderly Simplified Application Project. Some folks may have heard it called ESAP. So what this does is households who have all seniors or disabled individuals with no earned income can qualify for this program. It helps ease the paperwork burden on households, but administrators as well. It will utilize more data matching, so it will be able to data match your name, your income that you might receive from SSI, and you don't have to complete an interview at recertification. Period is also extended to 36 months. So you don't have to submit any additional paperwork in the middle of that. It's really there to increase the amount of seniors and people with disabilities who are accessing SNAP, because we know that applying for SNAP can be a burden.
Yeah, what I like about it is recognizes we're in the 21st century where there's technology that can actually talk to each other. So why go back and try to recertify? Because that's when people get knocked off. So what you're saying is it does that on its own. And once you're eligible, you don't have to do it again for 3 years to make it as easy as possible. And then people don't wind up getting kicked off because they didn't recertify in time or and then have to go through the whole application process all over again.
That's exactly right.
So we have 2 tools on our website. I believe Kelly is going to put them in the chat. You know, we developed during the pandemic a whole series of web-based video tutorials for people to get a line-by-line assistance on how to apply for a variety of benefits from Medicaid to SNAP. And then Kayla, you helped us now with the Simplified application as well. There's a video tutorial on that as well. So Kelly's going to put that in the chat box. Check out those videos, but other ones as well, like the Medicare Savings Program, the Low Income Subsidy, HEAP, Medicaid, and many, many others that we have put together to make it as easy as possible for individuals or families to apply for these things. And they're not just specific to older adults. Some of them are, but some of them people of all ages are eligible for. So what other rules help older adults access SNAP?
So earlier we talked about categorical eligibility. Seniors can qualify at 200% of the federal poverty line. If they don't qualify under that, they may be able to pass the net income test, and they have a higher resource limit as well. Seniors and folks with disabilities can also utilize the excess medical expense deduction. So what you can do with that is report any out-of-pocket medical expenses that exceed $35, and it can really help boost your SNAP benefit amount.
So can I stop you there for a second? When you
Sure.
talk about excess medical expenses, there's a lot of those. Do you have to, for folks watching, they're not going to know what that means. Do you have to save receipts like you would if you were submitting to your flex spending account, for example? How would that exactly work? Because obviously many older adults have hundreds or thousands of dollars of out-of-pocket medical expenses that are not covered. What would they need to do?
Yeah, so save your receipts. The local DSS offices should be screening folks upon their applications for this medical expense deduction. Save your receipts. Even, over-the-counter medications that your doctor may prescribe might be eligible for these. There is, in the video that we created is the list of some of the expenses and utilize that for. But over-the-counter medications, prescription medications, even your insurance deductibles, and some people have service animals, so care and food for service animals might count towards that as well. So there's a lot of things that fall into that excess medical expense deduction that folks can claim.
Okay, and again, I believe one of the resources you provided us has some of that additional information, but we also have the videos. And then we get to the very end, I want you to talk about the no-ups, where they are, what they do, because the most important thing with info is to do something with it. And we want to make sure that we connect people. So some folks, fairly recently have noticed an automatic decrease in their SNAP benefits. Can you explain why that happened?
Yeah, so there was a cost of living adjustment increase back in October of 2021. So about 70 million Americans received a 5.9 increase in their Social Security benefits and supplemental security income payments. And every time this happens, the USDA will adjust the SNAP maximum allotments, and the changes that they make are based on the cost of living.
Okay, and that's not something anybody, let's say, Kayla, again, because this is your expertise, let's say that when I applied, I have an allotment that I got based on my income, right? But I didn't have excessive medical expenditures. If I'm in either the Simplified app, the 3-year period, or sometime in the year, and something happens that increases those things, can I go back or do I have to wait until a recertification?
You don't have to wait. You can report that when it happens. They shouldn't be taking any negative actions against you should something go down. So if something happens and you have more out-of-pocket expenses or your rent increases, definitely report those changes.
Okay, let's talk a little bit about the Nutrition Outreach and Education Program. I believe you do have statewide coverage at this point, which was not always the case. What do they do and where are they?
So the NOAA program, the Nutrition Outreach and Education Program, is in several counties throughout New York State. We're not quite in every single county. But a lot of counties have at least one NOAP coordinator. What NOAP coordinators do, they are embedded in our community-based organizations, and they help folks apply for their SNAP benefits. They can also answer any questions that you might have about SNAP benefits. They can screen you. They can offer translation services. They can help refer you to other food assistance programs if needed. They're really there. They're there to provide free and confidential services to folks who need them.
And they're trained, and that's critical because it's not as simple as your income. There's a lot of questions that should be asked of somebody who may be interested to try to maximize their benefit, and take into account some of the additional things that you talked about with the out-of-pocket costs and some of the others. So I think Kelly is going to put that in the chat as well. The other resources are Offices for the Aging at the local level, and then we have those two videos, the traditional SNAP and then the Simplified SNAP app video tutorials. But you guys have been great partners to us. We've done some cross training. We have quite a few counties that are paid by the Department of Social Services to do SNAP applications, but it's not everywhere. And there's more than enough to work to be done. So any of those places to refer people to is great, but you should definitely check out where the NOAPs are, because this is the number one job, is to help increase access to federal feeding programs, and certainly SNAP is one of them. So are there other types of things that people should be thinking about if they are hungry? We have the Emergency Food Network, you've got SNAP, we have our home delivered meal nutrition and our congregate meal program as we start to open up some of those senior centers and congregate meal sites. Are there other things that people should be aware of that are out there that could assist them?
There's SNAP, obviously, and there are guidelines in place if there is a disaster or something happens, say you lose electricity, you can access SNAP as well to help replace some of that lost food. But as we all know, food pantries are another resource that folks can utilize as well.
And tell me about farmers markets. Are SNAP benefits allowed to be used at farmers markets?
They sure are. I think Kelly might have dropped it in the chat. If you are looking to find a local retailer that you can use your EBT benefits at, you can search on USDA's website for that. But you should be able to use your benefits at a lot of local farmers markets. Some of them have other programs that help you really maximize those benefits. They'll give you, a couple extra dollars to spend and put towards produce or other goods as well.
Excellent. So now I'm going to ask you an open-ended question. What didn't I ask you that you want folks to know, to understand, or additional resources that might be available to them? I mean, obviously the goal is to help anybody and everybody, regardless of age, eat. It's a lot of us take that for granted until it happens to you, and there's no reason for it with some of the supports that we have in New York State.
Yeah, you're absolutely right, Greg. No one deserves to go hungry, and no one should be going hungry. But one thing I wanted to mention is the New State Kind Application Project. This is an auto enrollment program that began on December 1st in 2021. It is taking over for the New York State Nutrition Improvement Project. So what this does is if you are a senior and you live alone and you receive Social Security income, it will automatically enroll you into SNAP. So you don't have to fill out an application. If you do get enrolled into that program, you will receive a packet of information in your mailbox with your EBT card as well. So your case will open initially with that $20 minimum benefit amount that we talked about earlier. In that packet, there is a report form that you can fill out to report your medical expenses or your rent and other things to help increase that budget. And what you need to do if you are put into this program is use your SNAP card within 90 days, or else your case will be closed. So some folks aren't aware of that. We want to make sure we get the word out. If you're enrolled into the New York State Combined Application Project, so you may hear it referred to as NICE CAP, that is something that has been done on your behalf when you enrolled in SNAP benefits, and we want you to use those.
Okay, so let me see if I get this straight. So somebody is auto-enrolled. They will receive a packet, get $20 minimum, but if you fill out the forms in the packet, then it's like a traditional SNAP app where those benefits will go up. Okay, so that is on the front end, a great thing. On the back end, not so much. That's going to be very difficult for people to, first of all, understand what they just received and why, and then potentially to fill that out, which is why we have you on here, because we have a network of organizations that you work with that do this for a living. So if you're a caregiver, if you're an older adult, if you are a friend or a neighbor of somebody that mentions this or receives this, if you're helping with mail or what have you, then you'll know what this is. Call one of the NOAA programs and get the assistance you need so that you can maximize the benefit. That's important. So I think we want to try to make it as easy as possible. Sometimes it always isn't, but I love the auto enrollment part of it.
Yeah. And if you need help with any SNAP related activities, you can find your local NOAA coordinator by visiting foodhelpny.org. You can type in your zip code and a list will populate with the NOAAs in your area, and their contact information will be there as well.
Great. And I think we have that in the chat so people can check. And I think we loaded that up on our website as well. So we're going to continue to work with you guys to make sure that we get all this information out. You know, I think a lot of folks don't know what they don't know. And I don't either. I don't know what I don't know.
Me either.
No. What I have learned over my time, and I think, you know, you have as well, Kayla, is there are so many, you know, state, county, and local organizations that are trying to do so many things in distinct areas or broad-based. And, you know, one of the reasons why we like to do things is constantly connect the dots. You know, we're in the nutrition game, you're in the nutrition game, and we need to make sure that regardless of where you are in any part of the state, that if this is an issue that comes up, folks know about you, folks know about us, folks know about the Emergency Food Network and some of the policy and program changes that have occurred, whether it be pandemic or just a simplification like the, you know, the Simplified application. So I can't thank you enough for being here with us today. I think that the passion that you have, and certainly Hunger Solutions that I've worked with for years and years, it's really, really important. And so we need to do as much as we can collectively for the network that we oversee, as well as you guys, to cross-pollinate. You're going to see people that are eligible for SNAP that are going to need a referral for some of the other services that we provide, and vice versa. So I think, Kelly, we do have one question before we let Kayla go.
Yes, thank you. How does auto enrollment work for NICECAP?
So it's between the local DSS offices and the Social Security Administration. It's a way that folks who are seniors and live alone and receive SSI, it's a way that they're coded in the system at DSS. So it's all back end stuff. There's nothing seniors themselves or even application assisters should have to do in order to start that process.
Was there more to that question, Kelly, or just how the auto enrollment works? So I think the second part of it is if that coding happens, something automatically happens on an administrative level, but then the mail comes and then there's, you know, there's more that needs to be done. And I think that, like I said, the front end, I think is great. The back end is a little bit more difficult, especially when you're dealing with somebody that might have a visual impairment, might not understand what they have, might not understand it's an EBT card, might look like a credit card. You throw it away, you don't open it, you don't recognize, you know, why you would be getting something like this. There's a variety of different reasons why another action wouldn't be taken, but that's the key, is to connect folks to the individuals like in Kayla's network that know exactly what it is and then how to assist. All right. I don't think we have any other questions. Kayla, thank you so much for what you do for your entire team at Hunger Solutions. And we are excited to see you guys in a couple of weeks. March is National Nutrition Month. We have a lot planned for New York, given that it's the 50th anniversary, and we've gone over 1 billion meals served by the New York State Office for Aging and their partners over the last 50 years, which I think is just incredible. So, you know, stay tuned. We'll have a lot going on in March, not only on our Facebook Live, but weekly information just on how incredible this network is that helps feed older adults throughout New York State. So again, Kayla Snyder, thank you so much. And thank you all for joining us. Look at those resources. And if you think you might be eligible, inquire about it. No harm, no foul, but it could really assist you in maintaining your overall health and wellness. So we'll see you in a couple of weeks.